Investigating Homelessness, Stigmatization, and Behavioral Outcomes. Nanci Aruda, PS 510, Qualitative Analysis. Dr. Lillian Odera, PhD, Purdue Global University, March 18, 2019. Abstract. The aim of the proposed research study, utilizing covert naturalistic observation on a convenient sampling of homeless individuals throughout a city environment, in effort to explore whether or not homeless people are treated differently, i.e., stigmatized or discriminated against, compared to average individuals who do not appear to be homeless based on perceptions, stereotypes, biases, and behaviors assigned to those who do not have sustainable housing. A literature review was conducted of collected empirical data for a future planned qualitative research proposal, exploring the topic of stigmatization, discrimination, and biopsychosocial inequities facing homeless individuals. Theory summarization. Covert observation of stigmatization, discrimination, and biopsychosocial inequities facing homeless individuals further examines relationships between homeless populations and non-homeless populations in public settings to determine behavioral-based outcome differences. Keywords: homelessness, stigmatization, discrimination, biopsychosocial inequities. Homelessness, systemic structural components. According to Belcher and DeForge, 2012, causal relationships between social stigmatization and subsequent discrimination surrounding homeless individuals relates to stereotypical labeling, which leads to exclusion throughout social networks, employment opportunities, and political power founded on false perceptions of those who are homeless, labeled as the homeless, and their inability to functionally contribute to societal ecosystems of capitalism. Social inequities. In addition, Belcher and DeForge, 2012, state there is evidence to argue collapse of social equities through maldistribution of wealth and resources across social class stratums, contributing towards increased poverty, addiction, domestic violence, incarceration, and mental health illness rates, which affect access to education and healthcare, proper nutrition, stable income and housing, and viable employment opportunities. Stigmatization and discrimination. Ziegler, Marcus, and Singer, 2017, presented 5 main corresponding references to homeless stigmatization based on false perceptions of the homeless as blamable objects or social failures. 1. Stigmatized strata of poverty-stricken populations responsible for their personal failures. 2. Viewed as disruptive because they are forced to spend time exposed in public spaces. 3. Lacking basic shelter amenities, often unable to utilize proper hygiene practices, thereby viewed as a health threat. 4. Associated with mental health and substance abuse disorders. 5. Easily targeted and blamed for systemic, societal, structural problems of which most of society fears. Group discrimination theories. Joining and maintaining group membership barriers and psychological resources in community, providing social support structures for a sense of well-being, are inhibited in homeless populations. Based on their research, Johnstone and colleagues' 2015 theory of group-based discrimination would be a powerful predictor of an individual's ability and motivation to turn to groups for viable coping mechanisms against negative biopsychosocial effects of homelessness. Evidence from the Johnstone et al. 2015 study supports the motivation for further naturalistic observational studies on homeless population inequities and disparities, proving those without sustainable housing are at higher risk for decreased personal well-being across life domains and opportunities for successful outcomes. Fuzzy logic and fuzzy cognitive maps. Complexities of social forces affecting homeless individuals, i.e., addictions, family breakdown, and mental illness, and the dynamic relationship to structural factors, i.e., decreased affordable or low-cost housing, insufficient economic conditions, and access to mental health services, is well represented using fuzzy logic and fuzzy cognitive maps. Mago and colleagues' 2013 Virtual Common Sense Map presented weighted arms between interdependent causal factors and approximate expected outcome values of homelessness for 3 sample cases, i.e., extreme case resulting in homelessness, rated as very high and high, least likely to end in homelessness, rated as low, and middle ground reflecting more realistic results, rated as medium. The Mega et al. 2013 Homelessness Virtual Common Sense Map generated from the FL and FCMs can be used to visually represent multifactorial data connecting complex, interdependent, causal concepts of homelessness gained from prior studies published using linguistic variables. Homelessness Virtual Common Sense Map. The image depicted on the screen was generated from qualitative data during Mango et al.'s 2013 study, showing interdependent arms and variables relating to homelessness, rated as very high, high, medium, and low. Research proposal: covert naturalistic observation and data collection. Research will consist of covert naturalistic observation of the homeless population located in Ybor City and their interactions, or lack thereof, with non-homeless individuals using complete observer techniques. Research question: is there a difference between population interactions and behaviors when homeless people are actively panhandling on the street versus passively holding signage identifying themselves as homeless? Qualitative behavioral-based data will be collected along Centro Ybor throughout the area's 2 busiest time frames: weekday lunchtime between 12 p.m. and 2 p.m., and weekend dinner time between 6 p.m. and 8 p.m. Covert observational setting: Ybor City, Tampa, Florida. Ybor City is a local area filled with history and culture located outside downtown Tampa Business District. Known for its homeless population among bustling shops and restaurants clustered along 10 city blocks, the area is an ideal environment to collect covert observational data on the targeted population. Final thoughts. Personal anecdotal experience. This research is motivated by a sense of humanity to further understand the relationship between homeless and non-homeless populates. Personal experience, gained from prior interactions with the targeted population. Lack of genuine engagement and respect for homeless individuals. Homeless individuals are ignored and treated with disparity as if ignoring the person will make the problem disappear. Homeless individuals are perceived as dangerous. And non-homeless individuals feel threatened, both physically and emotionally, by homeless individuals. Education is key towards comprehending impact of societal problem, acknowledging those who are homeless as human beings, equally deserving of the same respect and sense of humanity as any other person. Decreasing implicit biases through education and awareness. Having worked with Habitat for Humanity as a community outreach assistant, educating community about the services available through Habitat's nonprofit organization, I have personally experienced and witnessed implicit biases about the needs of those seeking affordable housing. Stigmatization, discrimination, and assumptions made about people with low or fixed incomes needing housing assistance can be altered through increased education, awareness, and resource access. Partnering in community with local area homeless advocacy organizations has decreased a level of personal implicit bias. Commitment towards future research and educating others plays a vital role in creating social change.